for me and advance the slides. So thank you everyone for allowing me to share with you today. And Olayinka, thank you for that introduction. And so my role with Smile on 60 Plus is I actually work as a lead community dental health coordinator for our program. So what I'd like to do, and I'm just really excited to be a part of the team. We, all the CDHCs are now certified level 3 ship navigators. So we're learning, and we appreciate being a part of this team, and just super excited to be presenting and sharing some information with you. So today my goal is to share with you just some current stats in the state of Tennessee that in relation for oral health for older adults. We're going to look at how does oral health play a part of overall health. I'm going to talk about Smile on 60 Plus, that program, give you some information on that, and also how you can help as a ship navigator. Next slide, please. So just to kind of share with you, Oral Health America did a report called The State of Decay back in 2018. And basically what they did is they looked at all 50 states, and there were several variables that they used to rank the states on how well each state was taking care of their seniors concerning their oral health. Number 1 was the very best in the nation. Number 50 was the worst. So in the chat box real quick, where do you think Tennessee landed? 1 being the very best and 50 being the worst. Where do you think Tennessee may have landed in that report from Oral Health America, State of Decay? All right, I'm seeing lots of 48s, 42, 33, 40. Actually, we ranked 49th. And as a dental hygienist, I've been a hygienist with over 30 years. That surprised me. It just really surprised me. So we as Tennesseans, we have some work to do. So just as this screen shows you that 34% of seniors in the state of Tennessee have had all their teeth extracted. 34%. 27% of adults have untreated decay. We know that Tennessee is one of 3 states that does not offer adult Medicaid dental coverage. These are some stats from the CDC. Back in 2014, we had more than 88,000 ER visits. Now, I can assure you that number is much greater today. And also the CDC in 2015 found that we had more than 1,000 new cases of oral cancer in Tennessee. So, as we all know that Medicare is the national health insurance for older adults, does not cover routine dental care, and the majority of people on Medicare have no dental coverage at all. As Ryan stated at the beginning of this conference, there's over 37.5 million enrolled in original Medicare. So those enrollees in Tennessee will have no coverage. Next slide, please. So, yes. What happens? Yeah, right there. Thank you. What happens in your mouth doesn't stay in your mouth. Now, if there's one thing I want you to remember from today is this slide. So that oral health is the foundation for overall health. Okay. And what we know that oral health just doesn't impact your physical health. It impacts the quality of your life. So if you had missing teeth, imagine how you might be embarrassed and how that may affect your relationships with your family, with your friends, with your community, how that could lead to pain, how that could lead to embarrassment and to isolation. So what we know is that untreated oral health problems can lead to serious health complications. Next slide, please. So untreated caries, that's cavities, dental decay, and periodontal disease, which is gum disease, can exacerbate certain diseases such as diabetes, cardiovascular disease, can lead to chronic pain, infections, and loss of teeth. What we know, if someone's experiencing periodontal disease, that's advanced gum disease, that they're going to have an associated increased risk for cardiovascular disease. That can include a higher risk for stroke. If you have untreated oral health issues, this can also contribute to poor glycemic control with your diabetes. And the obvious, if you have natural missing teeth, or if you have no teeth, that can cause nutritional issues and relates to health problems. Next slide, please. So this is one thing I want to share with you. This information is from the CDC and the Kaiser Family Foundation, an article called Drilling Down on Dental Coverage and Costs for Medicare Benefits. And basically, and this is looking at the nation as a whole, but 1 in 5 adults have untreated tooth decay. 68% of older adults have gum disease. That's 68%. 1 in 5 older adults have lost all their teeth. 65% of Medicare beneficiaries don't have any form of dental coverage, and that's 2/3. And then among the Medicare beneficiaries that use dental services, the average out-of-pocket cost for dental care was $922. And then every year, more than 200 million people visit the emergency room due to an oral health issue. Next slide, please. So even within our program of Smile On, we are finishing up our 2nd year. And so we've been collecting data. And so out of our 2 years of serving Tennessee seniors, 84% of our Smile On patients have cited that dental cost or lack of insurance is a reason for not seeking regular dental care. There's other barriers too, like transportation and things like that. But we do know the biggest barrier is cost or lack of dental insurance. Next slide, please. So what we know is that seniors are not being proactive with their dental care. So that's simply due to cost or no dental coverage. So I want to just kind of share with you a little bit about our program, Smile On 60 Plus, and what we're doing. So just a couple of things. We are statewide. We have 19 clinics with 28 sites, and we have a goal of improving the oral health and overall health of Tennessee seniors that are low income and dentally uninsured. To be eligible for our program, you must be a Tennessee resident. You must be 60 years or older. You have to be experiencing household poverty level at 200%, and that's based on current year data. That would be like for a household of 1, that'd be a salary of $25,525. I believe that's that figure. You have to be dentally uninsured, and if you are eligible and in the program, you pay a $25 copay to the partner clinic. So you now may be asking, well, if you are eligible and you're in the program, what does it cover? And so it basically covers all preventive, emergent, and basic restorative procedures, along with partials and dentures. And so by preventive, I mean that's exams and that's cleanings and x-rays. Emergent would be if it's an emergency visit, extractions are needed, oral surgery, if fillings are needed, that's covered. Partials and dentures, those things are covered. Things that are not covered would be a root canal, a crown, an implant, and in-hospital dentistry. Other things that we do, especially as a community dental health coordinator, we are out, actually before pre-COVID, we were out in the community meeting seniors where they were. So at the senior centers, we provided education, and everyone that attended one of our workshops actually received a free oral hygiene kit. We actually help with the transportation voucher if that is a barrier that's keeping a senior from initially going to a dental office, or if they're canceling appointments because they're having issues. We're able to work with various factors in helping them with that. We do case management, and I think that's been one of it's the best thing with the community dental health coordinators. We're able to help the seniors kind of navigate through this system. Sometimes just finding out first, are you eligible, and how to get to a partner clinic. And sometimes it's something as simple as getting in touch with the office. I don't know about you all, but sometimes you run into these phone systems. Press 1 for this, press 2 for that. And, there's a lot of patients that call me to let me know that they're going to be late, but they can't get in touch with the office and those kind of things. Or if they've had an emergency and can't get in touch with a clinic, we're able to help them through that. Next slide, please. And so just to remind you, our grant program is funded by the Senior Trust Elder Trust Settlement. And the administration of this grant is overseen by TCAD, the Tennessee Commission on Aging and Disability. We were awarded the dental health area. Interfaith Dental Clinic is the lead agency, and Smile on 60 Plus is the program that is statewide. Next slide, please. So we have 5 goals for the state of Tennessee with our program. So we want to be able to educate older adults in Tennessee on the importance of oral health across the lifespan. We want to control and or prevent oral infections in older adults. We want to correct oral conditions that prevent an older adult from eating or from smiling, which can lead to depression or isolation. We want to help a senior find that dental home. So if there is an emergency, you can go to your dental home, go to your dental clinic, and not the ER. We want to be able to help increase our dental providers, their knowledge and their education on caring for the older populations to improve outcomes. Next slide, please. So part of our process is we're providing education and resources. And, just like to your group as ship navigators, me being able to share this information with you today, we have materials that can help you help others that you serve. So we work, we may be at a senior center presenting to you as a group of ship navigators, different faith communities, churches, things like that, media outlets. We do workshops out in the community. Our community dental health coordinators are there in the community providing education and navigation. We have a hotline that our seniors can call and find out more information about. Next slide, please. And I mentioned this before, but currently we have 19 clinics statewide with 29 sites. So we have 19 clinics with 29 sites. To date, these numbers are through July of 22, so there's actually more updated information, but we have served more than 4,656 unique patients have been cared through our program. And we've had more than 35,710 direct encounters. And direct encounters may be someone that's called our hotline, someone that showed up at one of our educational events. Next slide, please. So this is just one of our cute patients, Miss Douglas, just kind of showing, she already has a great smile that you can see, but after going through some dental work, it seems like her smile is even brighter, and she gets lots of compliments, and she herself just enjoys smiling. So next slide, please. And this is another one of our patients that we've served Miss Hambry, and she actually hadn't been to the dentist in, around 15 years, and she didn't have dental insurance, and the cost was not in her budget. And she actually made an appointment with one of our partner clinics, but she was just there to have one tooth extracted. She just didn't know or didn't feel like she could afford comprehensive care. So she ended up being eligible for the program, learned about the program, being eligible for the program, and you can see how the dentist was able to restore her smile. I believe she was put into a new lower denture. All of her teeth were restored and a new upper partial. And you can just see a huge difference in her smile. You know, it truly, at Interfaith, our logo is a smile changes everything. And I truly believe that a smile does change everything. Next slide, please. So, and what you can, this is our information. We have a hotline, which that is 1-800-509-6055, and a website. And we have information that'll be going out to you that's going to give you our regional clinics in the West Tennessee, East Tennessee, and of course here in Middle Tennessee. And you'll also be able to have the community dental health coordinator that's in your region, their contact information. So you'll have their personal number and email. Now, one thing you can do if you have a client that you run across someone that might be interested, it's just as easy to give them the hotline, because our hotline will do a pre-screening, and that's to check to see if they're eligible and help kind of find the closest clinic to them. But you all know us now, the community dental health coordinator, so now you have a connection with us too. Next slide, please. So you may be asking, like, so how can you help? I think maybe there's a couple of things. It's just have an awareness. So when you are sitting down and working with your clients on trying to help them navigate through which Medicare plan may be best, just have a question maybe, what is your current oral health? And, do you have any possible needs for upcoming? Some of the questions that we actually use in our program is just asking a patient simply, are you limited in what you can eat? And if someone says yes, then you know right away that they're going to need dental care. Another question is the condition of your mouth, is it good, fair, or poor? And that information is going to help you know how to help someone. And a third question is, has the appearance of your mouth or teeth affected your quality of your life? And if someone answers yes on that, then you know that they're going to need probably more dental care. And then the other thing is just an awareness of the cost of dental care. And this is kind of a hard area to kind of explain, and because it depends on where you live and who your dentist is, what these ranges are. But just to give you all some information, let's say if someone needed full upper and lower dentures. Now, there again, it depends on where you live, what area of Tennessee, and who your dentist is. But that's a huge range, and that honestly can range anywhere from $3,000 to $4,000. Now, you may be able to even get this a little bit less expensive at a affordable dentures. That could be something. I'm not exactly sure of that cost, but it could be something even, around $2,000. So the fees across the state vary greatly, just like for a cleaning. Now, the average cost of a cleaning and an exam can typically cost $100 to $150. An extraction, if you have to have a tooth extracted, that cost, now that can vary too, because it depends on the complication of that, extracting that tooth. But that can easily be from anywhere from $100 to $300. So you can see, if you're working with a patient and trying to, navigate them and help them with their dental concerns, a plan that has $1,000, that sounds like, it's could meet a lot of needs. But we know that if dentures are needed, perhaps is that the best plan? And it may still be the best plan, because that gets a little, even in private insurance, if you're working and have private insurance, typically those benefits are $1,000 to $1,500 per year too. Now, what I would like to do is just remind you, we're going to be sending out some information that has our clinics, contact information, and frequently asked questions about our programs, just to remind you about eligibility, and if someone's eligible, maybe how to get them help. Like I said, you have my contact information, you have our 1-800, our website, and you're going to have each of the community dental health coordinators contact information. We have Kim that's in West Tennessee. We have Brittany in East Tennessee. And then Lindsay is in Southern Middle Tennessee. And I'm Nicki, and I'm here in Middle Tennessee. So what I'd like to do is just open up for some questions. You can put those in the chat box. And let's see if I can answer those for you. Let's see here. Okay, I'm looking at a couple. So it says, my residents love the Smile on 60 Plus program. Do I still need to use the application for referral or just give them the contact number? Well, that's a good question because it depends on maybe where you live and what clinic. All our clinics are a little bit different. I know for sure the first thing I would do is give them the 1-800 number. Our 1-800 number should be able to answer most questions. You have me and all the other CDHCs too to rely back on if you have any issues or once your client calls that 1-800 number and has any issues. Like one of our partner clinics, our lead agency, Interfaith Dental, actually requires their applicants to send in an application along with documents, and therefore they review this and go over it before the senior arrives just to make sure there's no surprises. And every clinic is a little bit different. I hope I answered that one correctly on that. Let's see here. Where's Smile On located in Northwest Tennessee? We have a clinic there in the Reelfoot Lake area. And Kim, I don't know if you're on here. Give us more information about Reelfoot real quick. I don't have it in front of me, unfortunately.
Sure. Can everyone hear me?
Yes.
Okay. I'm Kim. I'm the West Tennessee Community Dental Health Coordinator, and we do have a clinic at Reelfoot. For those of you who are familiar with Reelfoot Lake, it's about 10 minutes. It's in Olayinka County, and Brandy is the contact person at that clinic. And we also have Church Health here in Memphis and Christ Community Centers here in Memphis, Tennessee.
Thank you, Kim. Also, there's a question on here that says, I didn't see a site in the Jackson, rural West Tennessee area. You're correct. Unfortunately, we have some big gaping holes in this. In our Upper Cumberland, we have some holes in West Tennessee. Now, so the folks in Jackson would have to travel either into Memphis area or into I don't know. That's a big hole right there. I'm sorry about that. So, and then too now, and I want to remind you, you're going to be getting a resource that's going to list every one of our clinics and exactly where they are also. So basically, if you're in Jackson County, unfortunately, it's going to be Memphis, or it's going to be the Reelfoot, or it's going to be Middle Tennessee. And that's quite a gaping hole, I know. Someone asked here, how does this work with dental coverage in a Medicare Advantage plan? So that's a great question. And most of the Medicare Advantage plans will have dental coverage. Now, you all are much more experts than I am at this, but what I have found that this coverage ranges anywhere from a couple $100 to several $1,000s. But basically, so it gets a little difficult, and that's why we always ask patients to present their insurance card, their Medicare card, their Advantage or supplemental card, so that it can be reviewed. We've done a lot of research to help our partner clinics know what plans may have insurance and what those look like. So basically, if they have insurance through an Advantage plan, typically they are not covered under the grant program, because this grant is designed for seniors that are uninsured. Just kind of checking to see if I've answered everything. So something about Memphis, we do have lots of several clinics there in the Memphis area. That is Kim's area also. How long is the grant for? So we are finishing up our second year come mid-October. And the grant is funded for 3 years. We know there will be perhaps some type of an extension due to COVID. When COVID hit, a lot of our clinics had to actually close, and they were not able to provide care for weeks, and for some clinics, even months. So we do expect some type of extension for this program, but however, we don't know the details of that at this time. Any other questions? And did I skip any questions that I needed to answer? I think I answered that one.
Hey, Nicki, there was a
Yes.
question asking about the pre-screening process and how detailed the financial eligibility questions are.
So, so the question is, what does that pre-screening look like, and what needs to be what needs to be presented to find out if you're eligible? So pre-screening. So one thing, like, let's say if it's our hotline, or if I'm talking with a patient, I'm going to verbally go over a few things. And what I need to know is that you're not dentally insured, that your household income is within that 200% poverty level, and that you're a Tennessee resident and 60 years or older. While we're on the phone, or that's presumptive eligibility. Now, documents must be presented to the clinic to confirm eligibility. So typically what someone is sending in is their Tennessee driver's license or Tennessee ID, which has their date of birth on it, that shows they're 60 or older, that shows their residency of Tennessee. Usually a copy of an insurance card is requested, and that is whether it's your original Medicare or your supplemental or an Advantage plan. And once that is reviewed, the clinic would be able to know if there is any type of dental insurance connected to that. And then the household income. And we're looking at, typically that's Social Security benefits. People can turn in, if they're still working, their last 2 pay stubs, or sometimes a bank account that has that Social Security deposit there. So those are the documents that are needed to confirm eligibility. What other questions might y'all have?
Is there a smiling program for people not over 60?
This program is just for adults that are 60 years and older.
Everybody, my name is Adrienne Franklin, and I am the SHIP coordinator for the Aging Commission of the Mid-South. And our area is, we serve 4 counties. That would be Shelby, Lauderdale, Fayette, and Tipton counties. And today we're going to go over Medicare Advantage health plans. So Medicare Advantage plans, also known as Part C, as many of you know, but for those who are new to this, Medicare Advantage plan is an all-in-one alternative to original Medicare. You know, those commercials with Flo from Progressive where they go, we all bundle. That's what you can think of a Medicare Advantage plan as a bundled plan. So with these plans, you are getting typically your Part A, your hospital services, your Part B, medical services, and in most cases, you're also getting the Part D, which is the prescription drug coverage. Now, these plans may have lower out-of-pocket costs than original Medicare, so that can make them attractive to some folks. In most cases, people with Medicare Advantage plans will need to use doctors who are in their plan's network, but we'll get into that a bit more specifically later. And many plans offer extra benefits that you don't get in original Medicare. So many plans have some provision, limited or otherwise, for vision, hearing, dental. You always hear people ask, do we get silver sneakers? So those things may be included in a Medicare Advantage plan. Now, in a Medicare Advantage plan, and I always have to stress this with some beneficiaries because you'll find that a lot of people are really confused. They'll say, oh, I don't have Medicare. I've got such and such. And I'll often tell them, well, it does say Medicare Advantage, right? Uh-huh. So that first word, yeah, that's Medicare. Yeah, you've got Medicare. So you do often have to explain to folks that they are still in Medicare and they still have the same rights and protections that people in original Medicare have. It's just that their plan, how they receive those services work a little bit differently. So the Medicare Advantage plan will cover these services, but they may have to jump through different types of hoops in order to get those services than if they were in original Medicare. They may choose a plan that has prescription drug coverage. As I mentioned, most of them do, not all, but most. They can be charged different out-of-pocket costs, but they can't be charged more than they would be in original Medicare for certain services. And you can see those here, chemotherapy, dialysis, skilled nursing facility care. The Medicare Advantage plan can't charge them more than what they would have paid had they stayed with original Medicare for those services. Again, they can choose plans that have some extra benefits, and these plans do have an annual out-of-pocket cost limit. So that's another thing that may make it appealing for folks, is that there is going to be an out-of-pocket maximum on their hospital and medical services, which is different from original Medicare, of course. Now, we have listed here 5 types of Medicare Advantage plans. Now, in our area, we really only see the first 3, but we'll go through all of these because, as we know, plans differ based on not just your county, even your zip code can be different in what's available to you. So we have the Medicare Health Maintenance Organizations, or the HMOs. You've got the Preferred Provider Organizations, your PPOs. You have your Special Needs Plans, S&Ps or SNPs. Private Fee for Service Plan, PFFS. I don't know any other way to say that. PFS, maybe. Medicare and Medical Savings Account, the MSA plans. So focusing on these one at a time, HMO, which is probably the most common, or a bit of the most common. And I always explain HMOs and PPOs to folks. I'm like, well, did you have insurance with your job or with your spouse's job? Well, it's a little bit like that, where you had HMOs and PPOs for the most part. So with an HMO, generally speaking, they have to get their services from in-network providers, whether that be doctors, clinics, labs, hospitals. If they want coverage, in most cases, they need to get it from an in-network provider, or they're going to be responsible. They may be responsible for 100% of their costs. Now, some exceptions to this would be emergency care, out-of-area urgent care, or out-of-area dialysis. So, you know, I tell folks now, if you're out of your geographical area, if you're visiting your cousin in LA and you have an emergency, don't freak out going, where's my network? It's an ER visit. Just go on and go. Out of area dialysis, since that usually has to be coordinated anyway before you go somewhere when you're on dialysis, that's going to be covered. But if it's just you're staying 3 months with your cousin in LA and you get, I don't know, an ear infection and it's not an emergency, you might be stuck with that if you're not in your plan's network. So you do have to be aware of that when you have an HMO. In most cases, you do have prescription drug coverage with these plans. Oh, I'm sorry, let me back up to, can you get your health care from any doctor or other provider? There are some HMO plans that are called HMO Point of Service Option. You may see it as HMO POS, which is a very unfortunate acronym. But anyway, you may see it as HMO POS. In those cases, you may actually be able to go out of network if you're willing to pay a little higher cost. So you do have that little subset of HMO plans. But generally speaking, you need to be in network. So back to the drugs. Yes, you can get your drugs legal drugs when you have an HMO plan. For the most part, most plans provide them. In most cases, yes, you will need to choose a primary care doctor. From my experience, just with various beneficiaries, family members, and folks, I've seen where if you don't put one down, they kind of will pick one for you, which I also tell people is not unlike insurance at the job. I've had that happen to me, and you have to call and go, I don't know this person. So in most cases, you will need to choose a primary care doctor, which is why I always tell people before you enroll, find out if your doctor is in network so that you don't have to go around scrambling trying to find a new doctor. So if you know that your doctor is going to be in network, you've had that conversation, and go ahead and put that person down so they'll be listed on your card as your PCP. Do you need a referral to see a specialist? In most cases, yes, you do need a referral to see a specialist. And again, you want to make sure that those specialists are also in network if you want to have coverage under an HMO. Now, certain services, preventive services, you don't have to have a referral, and those will be covered just like they would be in original Medicare preventive services. And then some other things you might want to know about this plan. If your doctor or healthcare provider leads the network, as you see here on the screen, you'll be notified. But that's not a reason for you to have a special enrollment period just because your doctor up and left the network. They'll just let you know, well, you have some time, pick another doctor, or we'll pick one for you, and go see that person. So that's not a reason to switch plans. And I get that question all the time. Well, what if my doctor leaves? And I tell them, well, you'll need to pick another doctor, at least until it's time to switch plans. During the enrollment periods, which we'll get to later. Now, if you get healthcare outside of the network, you may have to pay 100% of the cost, as I mentioned earlier. And very important that beneficiaries read their plan rules. There are times that the plan would have covered a service had the beneficiary or the provider just done what was listed in the plan. They always go, these plans don't work. They don't cover this. Legally, they have to cover it. Did you do what the plan told you to? So you want to encourage them to, read it over. If they need help with that, they can always contact the plan and just ask, I'm not really sure what this means. Here's what I'm trying to get done. What should I do to make sure that they're, getting everything done the way it needs to be? Or their provider can do that also, just to make sure everything's on the up and up so they can get the coverage that they are entitled to, but they do have to follow those rules. As I mentioned, jump those hoops. The next, the PPO plan. So in this case, as I tell folks, it's a bit less restrictive than an HMO plan. In this type of plan, you actually can, in most cases, go out of network if you're willing to pay a higher copay or a higher coinsurance. But at least this allows you a bit more flexibility than an HMO plan would. If you go out of network with an HMO plan, in most cases, you're stuck with that bill. With a PPO, in most cases, you're stuck with a bill, but it's going to be a lower bill and you still have coverage. They will at least provide some coverage for you. So that's one of the differences between HMOs and PPOs. Also, with the PPOs, you still can get prescription drug coverage with most plans, so that's not a problem. You don't have to tell them upfront who your primary care doctor is. So again, I still would advise people to see if their providers are in network simply because it's cheaper that way and easier that way. But in most cases, they still should be able to visit certain doctors, even if it's out of network. But I always tell people, just to make it easy on you with costs, just try to find that information out on the front end. Also, you don't need a referral to see a specialist in most cases. Now, it may seem obvious to you that a PPO plan is not the same as original Medicare or Medigap, but trust me, it's not obvious to everyone. So you want to take the time to make sure you explain, because I've had someone say to me, oh, well, then that's just like having original Medicare then. No, it's not. It's still different. The fact that you have co-pays for every single service and they're varying by company to company which is different than original Medicare, which is pretty set no matter where you go, is one difference, just one. So you want to stress that this is still not original Medicare. You still have a health plan. You still have rules that you have to follow from this health plan that are going to be different from original Medicare. Now, they do often have extra benefits, as we mentioned before, that you would not be able to get with original Medicare, but those benefits often have a cost. So you just want to be aware of those things. And there are two types of PPOs. That's not up here, but there are two types of PPO plans. You'll sometimes see when you go through the plan finder, a regional PPO. And so these plans serve one of 26 regions that Medicare has decided. And these regions can be a single state region or a multi-state area. And then you have your local PPO plans. And these are going to serve just some particular counties that the PPO plan chooses to include. So you do have those two different ones. I know that threw me the first time I saw it a couple of years ago. It said Humana Regional PPO. And I was like, okay, so it's still a PPO, right? So that's the difference between the two. All right, the Medicare Special Needs Plans, or SNPs, SNP. So with these plans, you generally must get your care within the network, again, except for emergency care, out of area urgent care, or out of area dialysis. So once again, you're in Poughkeepsie and you have a car accident, no need going, but do you take my plan? Just go on and go to the hospital and get fixed up. And in this case, all of these plans provide prescription drug coverage. So the first two I mentioned, most of them do. With a SNP, they're all going to provide Medicare prescription coverage. In this case, you do need to choose a primary care doctor because, again, we do have networks, and you will probably need a referral to see a specialist, again, unless it's for certain services like mammograms and other preventives where you don't require a referral. And with special needs plans, now not everybody will qualify for a special needs plan. You have to be fit one of these three designations. You might qualify for a SNP if you live in the plan service area. So that's obvious. You have to live in that area, but you also have to meet one of these requirements. The first one is to live in an institution like a nursing home, or need nursing home level of care at home. So like somebody in Choice's program. So this would be an institutional SNP or an iSNP. The second qualification would be if you have both Medicare and Medicaid. So these are your dual eligibles, your D-SNPs. And then there are some people who have chronic illnesses that qualify them for certain types of special needs plans. So you can see the examples here. So these plans may limit their enrollment based on certain rules. These plans should coordinate your needed services and providers, and they should make sure that you have providers that you use, that you should make sure that your providers accept both Medicaid and Medicare if you're in that situation, if you're in number two, that boat. So if you have both Medicare and Medicaid, you've kind of got an extra task of finding out, hey, so you accept Medicare, awesome. You take Medicaid, you take Blue Care, because that's going to unfortunately further restrict a person's pool of providers that they can use. So you want to just make sure that you stress to them that they check with their providers which plans they will accept. But these plans are certainly helpful for people who they're developed for people who have these special needs, as I mentioned, and can provide some extra benefits that a regular Medicare Advantage plan like an HMO or a PPO may not provide. They can kind of go a little bit above and beyond for those who are in nursing homes, or for those who have Medicaid because of income and or illness, or for those who just have chronic illnesses or diseases. Now for one of those plans that this animal doesn't really exist in my area, but it may live in yours, a Medicare private fee-for-service plan. So with these plans, you can get your health care pretty much from any doctor. You can go to any Medicare approved provider. So doctors, clinics, hospitals, you name it, that accepts the plan's payment terms and agrees to treat you. So not only do they have to accept the terms, they have to agree to treat you. And, you know, that's typical of doctors. Are you accepting new patients? Yeah. Okay. If you join a plan that has a network, you can also see any of those network providers. You can choose out of network providers, but you may pay more. So just a little similar to the PPO on that aspect. If you need emergency care, that's covered regardless of whether the provider accepts this plan's terms. So it's just really important to stress to people, you know, don't worry about ER care, a true emergency, not when you're just using the ER for your medical care, but you have an emergency, just go. Medicare will take care of it. Don't worry about these boundaries. Now, are prescription drugs covered with this plan? Sometimes. You can see that there. So if they don't, you actually can get a separate Medicare drug plan, Part D standalone, to go along with this fee-for-service plan. You don't have to choose a primary care doctor, and you don't need a referral to see a specialist. So that kind of simplifies those things. Now, again, these are not the same as original Medicare, nor is it a Medigap. This is not a supplement plan. So we do have to stress that with folks. The plan makes the decision as to how much you're going to pay for services. Some of these plans will contract with the network, and in that network, they may agree to treat you without even having to see you before or get a referral or anything. Now, those outside of that network may decide not to treat you. I don't take that plan. I don't want to see you. Just we're not here for that. So you do have that going on. You do have to show your plan ID card each time you visit. For every service you get, you want to make sure that the provider agrees to treat you under that plan and accept the plan's payment terms. Just don't take it for granted that they will. Get that understood up front so that you know what you're getting into and know what your costs may be. And of course, again, in a medical emergency, doctors, hospitals, and other providers must treat you. And now for the Medicare Savings Account plans, or the MSA. So this combines high deductible insurance plans with a medical savings account. So this is where Medicare deposits money into account, money, and you get to use that money for healthcare services. Once you've met the deductible, you don't have any cost sharing, so no copays or coinsurances once you've met that deductible. These plans must cover your Part A hospital and your Part B medical services, and for an extra cost, they may provide some extra benefits like dental, vision, and long-term care, which is most certainly not covered by original Medicare. Now, if you need drug coverage, again, you must join a standalone Medicare Part D plan. So having this plan does not take care of your prescriptions. You're going to want to get that standalone plan unless you have creditable coverage elsewhere. After you get a letter from this plan that you join telling you when your coverage begins, they're going to give the plan an amount of money each year for your health care. They're going to deposit that into your account on your behalf. You can use this money to pay your health care costs, including health care costs that aren't covered by Medicare. Why isn't this in our area? I'm a little bit jealous. Okay. You'll have to pay for your Medicare covered services out of pocket until you reach your plan's deductible. I'm no longer jealous. If you use all of the money in the account and you have additional healthcare costs, doctors and other providers can't charge you more than a Medicare approved amount during the time you're paying out of pocket costs. Your plan will cover your Medicare covered services after you've reached your deductible. So again, once you've reached your deductible, no cost sharing. And any money that's left over at the end of the year stays in the account. So that can roll over and be used in additional years. Now, what are the Medicare Advantage plan costs? So this is just typical to Medicare Advantage plans, period. So your out-of-pocket costs are going to vary depending on certain things, such as, does your plan charge a monthly premium? Now, I know we have all seen it, that dreaded Joe Namath commercial, the bane of our existence, oh my word. And those commercials and commercials like them can confuse consumers out there, beneficiaries on a variety of levels. But one of the main sources of confusion that I've seen is about this premium. They'll hear people, and not even just the Joe Namath commercial, sorry, Joe, kind of, but other commercials about Medicare Advantage plans or Medicare health plans that you'll see when they talk about no monthly premium. You'll have people say, oh, so I don't have to pay the Part B premium. I always tell them, yeah, you do. Somebody is going to pay Uncle Sam that money. You might pay it, your mama might pay it, the state might pay it, but somebody's going to pay it. So always stress to them that is not, when they say no monthly premium, they're not referring to the Part B premium. So the Part B premium, as we found out yesterday, this year, 2021, is $148.50. So you're paying that. What they're talking about is the plan itself. So whether it's Humana, Cigna, Aetna, whomever, they may decide to charge their own monthly premium that goes to the plan, or they may not. but that does not affect, in most cases, that Part B premium. Until we get to the next bullet point, the plan may offer to pay some or all of your Part B premium. Now, in our area, I only know of one plan that contributes $40 towards the Part B premium. And as it mentions, they may call it a Part B, Medicare Part B premium reduction. So there is one such plan that provides $40 towards that premium. But again, that has nothing to do with whether or not they charge a premium. That has to do with whether or not they're going to contribute towards that Part B premium. So do make sure that the beneficiaries understand that Part B premium is always in play. Whether or not they pay for it, the state pays for it, or a plan is willing to make some contribution to it is another story. Now, whether the plan has a yearly deductible or any additional deductibles for certain services, some plans have deductibles for health services and deductibles for drug care, prescription coverage, I should say. Some have deductible for one but not the other, and some have a deductible for neither. So it just depends. Also, there may be extra benefits like dental where there may or may not be deductible. So you just want to check through that and see what those plans offer. This is going to vary plan by plan. And then, of course, your costs are going to vary depending on how much you pay for each visit or service. So this is what we mean by co-pays or co-insurance. So when people ask me, how much is it going to cost to be in this Medicare Advantage plan? Well, I tell them, well, first of all, that's going to depend. What do you need? And how often do you need it? Now, no one can predict the future. If they can, please call me. I have some questions. But we can't predict the future, but you can kind of guesstimate based on your use of the healthcare system in the past. You know if you're the type that's always running up to the doctor every month, like a friend of mine, if that's the case, then you can count on about at least 12 visits because you do it like that. You also know if you're the type that as long as you're in good health, you may see that person once and you might not see them till next year. So you can kind of gauge that, but we all know that, things happen that you can't predict. Illnesses may come, diseases may happen, accidents. I don't want to get too morbid here, but just let them know this isn't something that can just be set in stone. You're paying this and that's it. They can kind of average in their mind what they may pay and then kind of see how that fits their budget. So the type of healthcare services they need, how often they get them. Another thing that affects the cost, of course, is whether you're going to get the service from an in-network provider. Again, if it's an HMO and you're out of network, unless it's for one of those exceptions like emergency care, urgent care, and out of the area dialysis care, if you are not using a network provider and you're in an HMO, chances are you're paying that whole bill. Whereas if you're with a PPO or one of the other types of plans we mentioned, you may pay less if you go in network, more if you go out of network, but not the entire bill. So it just depends on if you're seeing a provider in your plan's network that will affect your costs. Whether your plan offers extra benefits and do those benefits require extra premiums. There are some plans that have their dental, vision, and hearing, just as an example, kind of built into, I guess is a way to say it, into their plan. So that's just part of the plan. I'm not saying that you won't pay a copay for it. You very likely will, but there's no extra premium to get those services. But there are plans, I won't mention them, but there are some plans where if you just get the plan as is, you might get a cleaning for your teeth. You might get to have one visit to the optometrist to see if your vision is as bad this year as it was last, and that's about it. But if you're willing to pay them a monthly premium of $13 on top of whatever you may or may not be paying them for the plan itself, then you can get a tooth extracted or you can get some contact lenses. If you're willing to pay the next level, let's say $31, you can get 2 teeth extracted. Now, so you may have extra premiums for those extra services depending on the plan. And then other things that will affect your cost, the plan's yearly limit on your out-of-pocket costs. So once you reach this limit, explain to beneficiaries, once they reach their out-of-pocket maximum, they don't have any more co-pays or co-insurances for their health and medical services. That does not apply to the prescription part of the plan. It applies to their hospital and medical services that they are receiving under their Medicare Advantage plan. So for instance, if you have a plan that has a $5,900 out-of-pocket maximum. Once you've used up whichever services, and I know this because I just had to explain this to someone 3 times in a 4-day period, 45 minutes each, same conversation. Once you've reached that $5,900, and it doesn't matter whether you do it using hospital services, doctor services, whatever service, labs, exams, all of those count towards that maximum. Those are all chipping away at that maximum. Once you've met it and you go back for that next MRI, they're covering that at 100%. And then whether or not you have Medicaid or get help from your state with some of your costs, that too is going to affect how much you're paying per year in your Medicare Advantage plan costs. Now, expanded health-related extra benefits. So back to Joe Namath, our friend. They always talk about you can get extra benefits, and then people start calling that line and calling you and going, where are my extra benefits at? And you shouldn't end the question with that, but where are my extra benefits? So we tell them, well, now that's going to depend on the plan, what they provide. But yes, they are allowed to provide some extra benefits. In most cases, these items or services have to be considered primarily health related. As you can see here, that would be if they're used to diagnose, prevent, or treat an illness or injury, compensate for physical impairments, improve the functional or psychological impact of injuries or healthcare, excuse me. So all of these things, and reduce avoidable emergency and healthcare use. So if those benefits contribute one of these ways, then a plan may be able to provide these extra benefits to their beneficiaries. Now, these benefits, again, must focus on the person's healthcare needs and can be recommended by a licensed medical professional as part of the care plan. So that's always the stuff they want to hear about. So just let them know that's part of qualification for those benefits. Now, here's some of the benefits that they will allow, that Medicare will allow these plans to provide. So there may be some extra benefits, and I won't go over all of these, just a few. Adult daycare services, that's one that we've gotten questions about quite a bit. Those are services that are provided outside of the home, and they may provide transportation to and from the adult daycare facility. You also have some services provided for in-home support services. So those would include things that would assist people with disabilities and or medical conditions in performing activities of daily living and instrumental activities of daily living within the home. So those might be allowed by the plan. Those might be some benefits that they can provide. Medically approved non-opioid pain management, try saying that 5 times fast, but these can include medically approved pain treatment alternatives like therapeutic massage, also some home and bathroom safety devices and modifications. Some of these things actually are provided by Medicare, but what they're referring to here are those that typically would not be provided by Medicare and yet would still fall under this category of home and bathroom safety devices. So these are, and over-the-counter benefits. Now, as Amanda mentioned yesterday, typically speaking, you don't get over-the-counter, well, not even typically, you don't get over-the-counter prescriptions or drugs actually through Part D. They're not paying for your aspirin or your Advil. Now, if it's prescription ibuprofen, that's another story, but just Advil off the shelf, no. But some of these plans are allowed to provide some over-the-counter benefits. I know for some of the SNP plans, that's certainly the case. In fact, I had a gentleman come in. He needed one help, and then he asked to stay and get some help picking out some over-the-counter medicine because he was legally blind. He had the catalog, so Laura and I helped him. Actually, we had fun. We called it Shopping with Mr. T. So that can be a very useful benefit for some people. All right, so some of those non-opioid pain management extras that we mentioned before. So CMS is encouraging Medicare health plans to consider these extra benefits that address medically approved non-opioid pain management and complementary and integrative treatments. That's a sentence. Okay, so as you can see here, some of those things that they may provide: peer support services, psychosocial services, and cognitive behavioral therapy, non-Medicare covered chiropractic services. So there's a very small subset of chiropractic services that Medicare will provide for. So in this case, they're meaning things that go beyond that very restrictive set of services that would be allowed. There are some extra benefits that a Medicare Advantage plan may be allowed to provide in this case, acupuncture and therapeutic massage. They can also have some special benefits for people who are chronically ill. As we mentioned before, we have some of those special needs plans for chronically ill persons. So they may have some additional benefits, and these additional benefits may not necessarily be considered primarily health related, as we mentioned earlier. So these are going to be to enrollees who are chronically ill, and when these additional benefits have a reasonable expectation of improving or maintaining the person's health or overall function. And here's some examples of those non-primarily health-related items and services. I won't read them all, but you can see here, home delivered meals, pest control, because we all know pests, besides just being icky, but they actually can have an impact on a person's health. You know, they can lead to illness and disease. So some of them can provide for pest control, social needs benefits, structural home modifications, general supports for living. So these are just some, not all of the items that can be provided for someone if they are chronically ill and have that type of Medicare Advantage plan. So now that we've gone through the different types of plans, the benefits that you might be able to get from these plans, yada, 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 how about who the heck can get in this plan in the first place? So who can join a Medicare Advantage plan? To be eligible, you must be enrolled in both Part A and Part B. We heard yesterday, in order to get prescription coverage, you only need to be in at least one of these. But for a Medicare Advantage plan, it must be both. Also, you would have to live in the plan's service area, so that's important. You must be a U.S. citizen or lawfully present in the U.S. and not be incarcerated. Also, you are going to have to provide the necessary information to the plan. You know, when people say, I don't want to provide that information. Okay, you don't have to provide it to me. You can call the plan directly. I don't want to tell them that either. How are you going to get in the plan then? They have to be able to verify that you're in Medicare. So along the way, you're going to have to trust that you are calling a verified source. But I have no problem, as you'll hear later, when it comes to fraud and abuse, with somebody verifying that you are true blue. But at some point, you're going to have to give up the information. In order to join, you have to follow the plan's rules, and you can only belong to one plan at a time. Medicare plans and end-stage renal disease, or ESRD. Good news, starting January 1st of this year, people with ESRD may join a Medicare Advantage plan without the restrictions that you see below. Before January 1st, those folks had restrictions. They weren't able to join plans unless they, you know, kind of met some of these exceptions, but that's no longer the case. If a person has ESRD and they want to join a Medicare Advantage plan, cool. How can you join a Medicare Advantage plan? You can call us for starters. Call SHIP. We're happy to help. Happy to help provide information on the various types of plans, what's available in their area, what those plans provide. You know, we'll send detailed information. And once they have chosen a plan, we certainly can help them enroll in most plans, generally not the SNPs, but in most plans. So, you know, I'd like to see that on this slide. I should have added it, my fault. But they can always call us. But if they don't, they can use Medicare's Plan Finder at the link you see right there. They can go to the plan's website itself. So you can go directly to Blue Advantage Garnet, directly to Cigna's website. You can join, in most cases, you probably can join online. You can fill out a paper enrollment form. You can call that plan, or you can call 1-800-Medicare. You see the number right there. I'm a big advocate for calling SHIP. You can call us, but you know, I certainly tell people, especially when it's during open enrollment, hey, if open enrollment ends on a weekend, don't wait on me. I'm not at the office on Saturday. Call 1-800-Medicare 24/7. They've got you. So a variety of ways that people can join a plan so they don't have to miss out on any dates that are provided for them to join a plan. They can join these plans in a variety of fashions. When can they join the plans? Now, we mentioned yesterday that 7-month initial enrollment period. Well, same thing. During your initial enrollment period, you can go and join a Medicare Advantage plan. These are definitely for people who've probably prepped a little bit in advance. You know, they've got their A and their B. They've talked to one of us, or maybe they went online and viewed what they wanted to do, and they make their selection during that initial enrollment period, and bam, they've got their Medicare Advantage plan. And we also know that the initial enrollment period is based not just on the 7 months surrounding your 65th birthday, but also that period surrounding your 25th month of disability benefits. And this is actually important with that disability. Some people will get the letter that they've got Social Security disability and Medicare at the same time because they've been waiting so long. So their 25th month is actually the very month they got the letter saying you've got disability. So definitely watch out for that one, because that can be a little tricky if you're dealing with a Medicare Advantage agent who's not quite aware that, no, these people didn't wait months and now they're doing it at the last minute. They just got the letter yesterday that they've got disability and Medicare. So if that happens, just be on the lookout. Make sure that that's well explained when you're helping somebody get into a plan. When can you join? Another time you can join is during the general enrollment period. As mentioned yesterday, the general enrollment period for joining Part A and or B is January 1st through March 31st. Now, if you have Part A already and you join Part B during that enrollment period, then from April 1st to June 30th is when you can join a Medicare Advantage plan. So you've got to get your A and B straight during that general enrollment period of January 1st through March 31st. Once you got that straightened out, you can join the Medicare Advantage plan April 1st through June 30th. Coverage will start July 1st. And then there are certain special enrollment periods that may occur that will allow you to join a Medicare Advantage plan outside of these periods that we just mentioned. So and one of those plans, we have the Medicare Advantage open enrollment period. So that started back up, I believe, in 2019. This is that 3-month period from January 1st to March 31st. And we'll get it confused with the general enrollment period because it's the exact same time. So you just want to make sure you clarify which period you're speaking of. This is the Medicare Advantage open enrollment period. This is for people who are, as of January 1st, already enrolled in a Medicare Advantage plan. So if that's the case, they've got 3 months in which they can do one of the following. They can switch Medicare Advantage plans. So they can go from the plan they currently have to a completely different Medicare Advantage plan, regardless of whether those plans have or do not have prescription drug coverage. So that's why you see all of those different computations there. They can also make the decision to drop their Medicare Advantage plan and go back to original Medicare during this period. And if they decide to do that, they can also at the same time enroll in a standalone Medicare Part D plan. Now, this does not give them a guaranteed issue right for a Medigap policy. You know, we spoke of Medigap policies yesterday and those guaranteed issue rights. This isn't one of those. This is just that time where you can say, hey, this Medicare Advantage plan is not working for me anymore. And I didn't realize that until this winter, and I want to switch. So they can do that. Again, you can only take advantage of this if you are already in a Medicare Advantage plan as of January 1st. This does not apply to Medicare medical savings accounts or cost plans. Like I said, in my area, those animals don't exist, but just in case they do in your area, this does not apply. How to switch. All right, so if you're already in a Medicare Advantage plan and you want to switch, you just choose the plan and you switch. One of those ways we mentioned earlier, those enrollments, calling us, calling Medicare, calling the plan. So if you've chosen to join a plan during that enrollment period, once you join that plan, it's going to automatically cut off your old plan. So you should be automatically disenrolled from the first plan when you're going into the next plan. So again, you can call Medicare, call your plan, call us to make those switches. And it also mentions here, just a moment, that if you go back to original Medicare, you should consider getting a drug plan to avoid the penalty later, because we talked about penalties yesterday. So now not everybody is willing to do that. I know a lady who was very adamant. She wanted a Medicare Advantage plan that had no drug coverage, and she had no intention of getting a prescription drug plan. As Ryan mentioned, we allow people to do what they want to do. We just want them to be informed. So as long as they are informed, so they can't come back later and say, hey, you never told me. No, I told you, but you wanted to do this and I'm happy to serve. But I wanted to make you aware of these things just in case you have a different idea. Default enrollment. So default enrollment is only permitted from Medicaid managed care plans into dual eligible special needs plans, or those DSNPs that we mentioned earlier, under the same organization when the enrollee is first eligible for Medicare. So if a person had Medicaid and they had a managed care organization, they may be automatically put into a DSNP with that same organization. So with Amerigroup or with Blue Care or with, what's the other one? United Healthcare. So that's a default enrollment. The plan must request and get CMS approval before implementing these default enrollments. These approvals can last for 5 years. The states determine if the Medicare Advantage plan can use the default enrollment. Have to give a 60-day advance notification, and the person can opt out of that. You know, they're not required to have it. I guess this is kind of a fail safe, you know, just in case they feel the person isn't going to make a choice. They want the person to at least have something as a backstop. But if that person's, gets the notification and they're like, who the heck told them I don't want this? Then they do have the right to opt out of that default enrollment. And choose something else. You always have the right to choose the plan that you want. But if you do stay in this plan, that coverage is going to start the same day that the person's Part A and B starts. And they can change, that person can change using the period we just mentioned, the Medicare open enrollment period, Medicare Advantage open enrollment period, or they can use a special enrollment period to make those changes. So they're not stuck with that. They're not forced into it. They have the right to make those changes. But if they don't make the change, then this is the default that they're most likely going to be placed into. Simplified enrollment mechanism. So this is an optional enrollment process for all Medicare Advantage organizations that offer MA plans and non-Medicare coverage. So this can be used in place of default coverage. It allows the plan to collect enrollment information that they don't already have. It's available to people in their initial coverage election period or initial enrollment period based on their initial enrollment in Medicare. Yeah, that's a fantastic sentence. Sorry for that. And no break in coverage between non-Medicare plans and the Medicare Advantage plan. And again, you always have the right to change, and you can change during one of these periods mentioned at the bottom. Now, what is the Part D monthly premium and income related monthly adjustment amounts, also known as IRMA? Well, you saw this a couple of times yesterday during the discussion about Part B as well as Part D. This is when a person or a couple, if they're filing jointly, this is when their income is above a certain limit. As mentioned before, fewer than 5% of people will pay these higher premiums. The same exact threshold that you saw yesterday is used here. And this is based on the income that you reported to the IRS 2 years ago. This is required if you have prescription drug coverage. So the reason this relates to Medicare Advantage plans is, of course, many Advantage plans offer prescription drug coverage. And if you don't pay these IRMA amounts to go along with your plans that provide prescription drug coverage, you'll be disenrolled. And that extra amount goes to the Medicare Trust Fund. So it's not going to Cigna, Aetna, Blue Care, whoever else. It's not going to the plan. It's going to the Medicare Trust Fund. Here's that fantastic chart again. And I won't go over every level. I just want to point out a couple of things. So in this case, we have 3 categories. I think with Part B, it was just 2. But when it comes to the prescription drug portion, we have 3 categories. On the left, you have a person who is filing an individual tax return. So all my single ladies filing an individual tax return. The next category for folks who are filing joint tax returns. Then you have folks who are filing married and separate tax returns. So the reason I wanted to point this category out is if you'll notice, there are 6 actually categories for the individual tax returns and 6 categories for the joint tax returns. But if you're married yet filing separately, you really only have 3 options. If you are, if you file and your income was $88,000 or less for each person filing separately, then you do not have an IRMA on top of your plan premium. Now, the next 3 categories that you would have as an individual or as a married person filing jointly, those categories do not apply if you're married and filing separately. You jump all the way down to this red box where it says if your income is above $88,000 and less than $412,000 per person, you're going to pay $70.70 on top of your plan's premium. So big, huge category there if you're filing separate, but you're married, where you're going to have a really, really big IRMA on top of your plan, premium plan. So that's just a very important distinction that makes it different from someone who's filing singly, where it's incrementally going up. Someone who's filing joint, it's incrementally going up. Someone who's married but filing separate, not so incremental. There's 0, and then you jump up to $70. So just wanted to point that out. Now, what is the Medicare Advantage trial right? So we heard this yesterday, but it's always good to hear things again for learning purposes. So these are those special Medigap, remember Medicare supplemental insurance. These are those special Medigap rights for people who join a Medicare Advantage plan for the first time when they're first eligible at 65 years old, or when they drop a Medigap policy. So that might be just a tad confusing. Let me see if I can explain that a bit better. But again, let's say you just turned 65, you've counseled somebody, and they want to go with an Advantage plan right away. So, you know, we mentioned that that person at 65, they've got Part B. Normally for a supplement plan, they would have that 6-month window in order to get a supplement plan where they don't do medical underwriting. You're going to get whatever the best price available is for people joining a plan at that time. But these people decide, nope, don't want that. I want a Medicare Advantage plan. Okay, cool. So you get the Medicare Advantage plan, 65, got Part B. Anytime during those first 12 months, you decide, oh my gosh, what have I done? You can return back to original Medicare, and now you have a guaranteed issue right. I believe it's 2 months to get that Medigap policy, and that guaranteed issue right for 2 months is going to act the same as if you had that 6-month one that you snubbed your nose at when you first turned 65. So that's that guaranteed issue right. Or if you have a Medicare, original Medicare, and you have a Medigap policy, and for the very first time, you're like, I want to try an MA plan. Okay. So you drop that Medigap policy, get an MA plan. You also get a guaranteed issue right to go back to Medigap. In some cases, you may be able to get your plan back. In other cases, you just have the right to get a plan. So that's a careful distinction. You do want to talk with your Medigap policy about that. But those are some guaranteed issue trial rights. Now, for Medicare Advantage plan network changes, we mentioned earlier that many types of Medicare Advantage plans have provider networks. These plans may change networks at any time, but they have to protect you from having your medical care service interrupted. So they have to give you some notice. So at least 30 days prior notice to that contract being terminated with that provider. So this gives you a chance to maybe wind up your care with that particular provider, be able to make some decisions about either, you know, transferring your care to another provider, or if you're adamant to stay with that one, at least you now know what the consequences of that decision are. So just to be aware and have the ability to make decisions in a timely manner, they have to give you that notice so that you can maintain adequate access to your services. In most cases, these network changes, as I mentioned before, are not a basis for a special enrollment period. So again, your doctor leaving the plan or the plan telling the doctor, we're leaving you, is not generally a basis for you to say, I should have a special enrollment period to change my Medicare Advantage plan. Most cases, that's not going to happen. It does say here, CMS determines eligibility on a case-by-case basis. If you truly believe you have a special reason why it should be considered, you know, all you can do is ask, and they can determine that eligibility on a case-by-case basis. But just know, generally speaking, not going to happen. All right, so here are some resources that you can go to find out more information about Medicare or Medicare Advantage plan. Of course, you have the Medicare and CMS website, socialsecurity.gov. And although this really has nothing to do with the topic, I just want to say, please remind folks that just because they have an online Social Security account does not mean they have an online Medicare account. Just want to get that straight. And so a few other things that can provide you with some information. You can download the Medicare and You handbook, or you can order it, as well as these other products on the medicare.gov/publications. If you are a partner, if you're registered with the organization, we can get some actual booklets at that bottom link down there. Now, here's some appendices that may be helpful. It kind of just reorganizes those earlier charts. And as a person who likes charts, I think this is pretty cool, but I won't tax you with them. Just showing you that if you need a quick reference to, hey, which plans do you have to pay a monthly premium? Well, here you go. You've got all 5 types of Medicare Advantage plans, and it tells you in the circumstances in which you may have to pay a monthly premium. Same thing for, you can just across the board see, does a plan offer drug coverage? Usually, yes, no. Also, quick guide to whether you can use any provider. So this kind of just puts it all next to each other, comparing the 5 types of plans as to whether or not you can use any doctor that you want to. And this gives you a maybe, yes, yes, no, yes. Also, do you need a referral? So you can see that. Just some more things that you'll see when you get the slides. This is really good just to kind of a quick and dirty way to help compare original Medicare to Medicare Advantage plans, especially when you're speaking with the beneficiary, either in person or over the phone. You can kind of just refer to this by saying, well, with original Medicare, but with Medicare Advantage plans. So that's kind of a quick and easy go-to that you can provide them, or you can just have handy when you're speaking with them. And so this just kind of goes over all of those differences between original Medicare and Medicare Advantage plan. And there we go. So any questions or comments or tomatoes, have at it. Thank you.
Thank you so much, Adrienne, for presenting. You did a wonderful job. Let's see, we have a couple questions in the chat box. Are there many, Emma asks, are there many private, is it PFFS plans in the area? I am not super familiar with the ones that might be in this category. And can you remind me, it stands for private fee for service?
Yes.
Okay. Are there any plans in the area? Do you know?
I don't know about statewide. I know not in not in ACMS's area, but I can't speak to how many might be available statewide.
Okay.
But I'm not familiar with them at all.
Okay. And then we have another question. Do you know of any MSA plans? I know you're more acclimated to ACMS, but do you know of any at all?
Yeah, that's what I mentioned before. The 3 that we're most familiar with here are HMOs, PPOs, and SNPs. Those others are, maybe across the state. They may not even be in Tennessee. I'll let some other coordinators speak to the availability in their regions.
Gotcha. And I think there's just one other question. How long does someone have guaranteed issue rights if they decide to switch back to original Medicare after doing the Medicare Advantage trial?
Well, in that case, again, if you're doing it in the first 12 months of having that plan, it's, I believe, a 2-month guaranteed issue right to go back to a Medigap plan without having that medical underwriting. Otherwise, if you wait beyond those 12 months, you don't have a guaranteed issue right. And again, it's only in those 2 situations where you turn 65, you got Part B, you went with the Advantage plan first, and within the first 12 months of having it, you like, no way, Jose. And then the other situation, you've had original Medicare, you've never had an Advantage plan, you get one, you're like, whoa, and you had to have had a Medigap policy already. And then you switch back, you have that 2 months. But if it's not one of those 2 situations, you're not going to have a guaranteed issue right just from leaving a Medicare Advantage plan.
Alrighty. Well, thank you so much, Adrienne. You did an amazing job. That's our second presentation of the day. So at this point, we're due for about a little bit of a break. Is everyone okay with taking about like a 15-minute break and then we come back with Lonnie's presentation? Let us know in the comments. Also, Adrienne, I hope you see everyone's praising you for your wonderful presentation skills. You did a great job.
Thank you, guys. You're very kind.
Okay, let's do a 15-minute break and then we'll come back and then start up with Lonnie's presentation and Plan Finder. Okay, yeah, if everyone will just be back. All right, good morning, everyone. My name is Olayinka Kasunmu. I am the statewide volunteer program coordinator for Tennessee SHIP, and I just wanted to go ahead and give a small overview of the Plan Finder. So we're going to start from here. This is the Medicare.gov website. To get to the Plan Finder, one easy way to do is go to Medicare.gov, click on Health and Drug Plans. Go to compare, or go, let's start with Find Health and Drug Plans. Here, it'll take you to this website, medicare.gov/plan-compare. Is another easy way to get there, but for argument's sake, let's start here. So what we'll do is we will, if the beneficiary that you're assisting has a Medicare.gov account and they feel comfortable with sharing their login with you, or if the beneficiary doesn't have a Medicare.gov account yet and is open to you helping them find and create an account, you can go ahead and go to this login or create account. But for today, we're just going to continue without logging in. So when you get on here, it's going to ask you a few quick questions. The questions include, I want to learn more about Medicare options before I see plans, Medicare Advantage plans, drug plans Part D, Medicare drug plans Part D with Medigap policies, or just Medigap policies only. Today we're going to start off with just a regular Part D drug plan, and I'm going to use, let's say, this is zip code 37243. It's for the national area. And as a reminder, that Part D drug plan is just drug coverage to original Medicare. They'll then ask, do you get help with your costs from one of these programs, including Medicaid, supplemental security income, Medicare savings programs, extra help from Social Security? If the beneficiary is sure of which programs they have, we can go ahead and select that. But for today, I'm not going to select any of those. They'll ask, do you want to see your drug costs when you compare plans? Say yes. And let's say the beneficiary we're helping today usually just goes at a retail pharmacy. It'll take you to this page. What you'll do is start to type in the drugs that they mentioned. So let's say this person that we're helping takes metformin. Sorry, all caps today. You can add the drug on here. Let's say they take the metformin, 500 milligrams. And they take 2 a day. So you can have it as they take 60 every month. Or they take 60 tablets each month. Then we can add their insulin. So they use Lantus. Be a couple selections. So there might be the 100 unit per ml solution, which might just be in a vial, but then there's also a Lantus 100 unit per ml injector pen. They're sold, each pen has 3 milliliters in it, which is about 300 units, and they're sold in a pack of 5. So we could say this person uses 1 pack of 5, or they use 1 pack of 5 each month. You have that in there. Say you're done adding drug costs. And then you can use the beneficiary's zip code. And if they have a pharmacy in mind that they prefer to go to, you can type it in there. But what I'll say is this person really enjoys filling at Publix, but they're interested to see if their medications will be any cheaper at Kroger. Press done. Come on here, and this is the page with all of the results. They are automatically sorted by lowest drug and premium cost. You can also do a couple different filters. You can say, okay, I want a prescription drug plan, or I can switch to a Medicare Advantage plan with the parameters already set. If someone is loyal to a certain insurance carrier, we can definitely filter through plans from that insurance carrier. If there is a certain star rating that the individual is more comfortable with their plan having, we can filter through that. And as of last year, they had this insulin savings program, which brings down the monthly cost of insulin to about $35 a month. If that is something they're concerned about, we can go ahead and put this in here. But the overall costs are already included in here and with our lowest drug and premium costs. A few more. Oh, actually, there's one. So we can see out here, it'll tell us the drug plan, excess scripts, Medicare value, PDP. We'll see the star rating, the monthly premium, the total estimated yearly drug and premium costs, and then the drug deductible. It'll tell you whether the pharmacies you selected were in network. Another cool feature we could do is compare 3 plans, up to 3 plans currently. So I'm going to select that first, Express Scripts Medicare Value PDP plan. Include the Cigna Secure Essential RX PDP plan, which has a $24 monthly premium, and the Cigna Secure RX PDP plan. Hit compare. Oh, amazingly today. And then it'll show you the 3 plans side by side. So it'll say, okay, these are the 3 plans. Here are their monthly premiums. Here are their star ratings. Here's the yearly drug deductible. The standard deductible is $445 for the year. It'll say whether the 2 drugs are covered or not. As you can see from here, it is lower price overall if someone wants to get their drugs at Kroger. It looks like Publix is out of network for the 3 lowest overall plans between the 2 pharmacies. But you can see from here, the lowest card plan, this has an estimated $179.90 for the year. That's including drug and premium costs. And then it goes up slightly with the second plan, and then up again about $20 with the Secure RX plan. So if you want to get a little bit more plan details, you can go on here, click plan details. And this will give you a full overview of the plan. So it has the premium and deductible costs, of course. It breaks down the drug costs for preferred generics, preferred brand, non-preferred drugs, specialty tier, and select care drugs. It'll mention again which pharmacies are in network. It'll show you, okay, the Lantus is $446.50 retail. Before the deductible, it's $0 for you. After the deductible, it's $0 for you. And then in the coverage gap, you'll have a copay of $111.63. After the coverage gap, you'll have a cost of $22.33 when you don't pick up that Lantus. As for metformin, it's again no charge until after the deductible. Well, once you get to that coverage gap, where it's about 44 cents for the medication, and then the cost after the coverage gap will be $1.75. Based off of that $179.90 per year on drug and premium costs, you won't meet that $445 deductible. So you won't really have to worry about the costs after this. And it'll show you the estimated drug costs. These are prorated, so it views this as if you sign up for this plan today, it'll start June 1st. So these will be your costs monthly. These are just drug costs, not the premium. You also have that $25.70 a month. And then you can see for here, with that Publix pharmacy is not in network, so you'll have to pay the full price of these drugs, which is a bit costly. It's around $551 a month for everything. It gives you more information. Sorry. I'll show you the drug tiers. There's quantity limits. So this metformin, you can only get up to 150 in a 30-day time frame. Sorry about that. I'll show you, okay, these are the drugs you added to your drug list. Here are the Part B drugs. Chemotherapy drugs and other Part B drugs obviously are covered by Part B, so they don't have Part D benefits. You can see some information on the star rating. And at the end, we have contact information for the plan. We have the website. We have their mailing address. And usually if people, I would give and highlight the non-member line, so when people call, they can they'll go directly to where they need to be. But that is about it for this drug plan. One other very neat feature of Plan Finder is if someone is interested in viewing both PDP plans and Medicare Advantage plans, you can easily switch. So usually I just start with the PDP, go through, do that comparison. Then I come over here, see view 42 available Medicare Advantage plans. And then we have the Blue Advantage Garnet plan. It switches to it. Show you whether the plan had, the one thing I will say is that there's one small difference. It has this, whether it includes drug coverage or doesn't include drug coverage for the filters. You could also filter what additional benefits people are looking for with their Medicare Advantage plan, whether it being vision, dental, hearing, transportation, fitness. If they are more interested in an HMO or a PPO plan, we can still filter through those. But let's start here. It automatically sorts by the lowest drug and premium costs. We can see here our first choice is Blue Advantage Garnet PPO. This AARP Medicare Advantage Plan 1 HMO. And this AARP Medicare Advantage Walgreens PPO. And also just sign up, just because it says Walgreens in the name, that doesn't mean that the plan is only eligible to be used at Walgreens. So for a lot of Medicare Advantage plans, they usually have a $0 monthly premium. And then you can see the star rating. There's like a health deduct. Sometimes there's a health deductible. There's not one here. There's at times a drug plan deductible. Not here. And then it gives you that maximum for you pay for health services. So for this first plan, it has a $10,000 in and out of network maximum. But if you do all your services in network, your out-of-pocket maximum will be $6,700. This second plan has a $5,900 in network deductible, and this last one has a $10,000 in and out of network deductible, or in and out of network maximum salary, sorry, and a $5,900 in network maximum. It has the Part B premium in here. A lot of people think once they start a Medicare Advantage plan, they no longer have to pay that Part B premium, but it is still included in your monthly Medicare costs, whether you have a Part B plan or a Part D plan. So then it'll detail side by side the plan features. So it looks like all three of these have vision, dental, and hearing, but then they start to differ just a little bit. Some may have over-the-counter drug benefits. Some may have, meals for a short duration. So it really just has to, and some have like limited dental services that they can have. It really is just up to the beneficiary what is most important for them to evaluate which plan will be best. And then it goes into details about how much someone will pay for a primary doctor visit, a specialist visit, different procedures, x-rays, emergency care, things of that sort. So just kind of goes through some information. And then we get down here and it has that drug coverage and costs. So it shows you, okay, so total estimated drug and premium costs for the year, which will just be those drug costs, since these plans have no monthly premium. If you get it at Kroger, it's $252 for a month for the lowest cost plan. So let's go ahead and click on these plan details. Again, it's very similar to the Part D plan details where you go through. It gives you, but here it gives you their estimated yearly costs. This is kind of just a estimate of how much they think you'll pay for costs of the year. It's not a definitive number, it's just kind of a small estimate. So the maximum you pay for health services, different benefits. They have a provider network benefit directory on here. So you just click on here, it takes you to that Blue Cross Blue Shield Medicare website to see if the providers you have currently are eligible for this plan. There's also, it gives details about different tests and things that could be done. It gives you information if it needs prior approval. Skilled nursing facility information, hospital services, preventative services, ambulance, therapy services, mental health services, opioid treatment programs, and then extra benefits and costs. So if someone wanted to get this plan and get a hearing aid, then it could be anywhere from $599 to $899 copay. But for a hearing exam, they have about a $10 copay. Gives you some information about the dental services, preventative dental, comprehensive dental coverage, vision, medically approved non-opioid pain management services. Some plans do include acupuncture, chiropractic services, massage therapy, and other pain management services, but this plan doesn't look like it does. They have some other benefits, and then it goes into details about their drug costs and coverage, gives you those preferred generic, brand name, preferred drugs, and all of those good costs. And then it gives you those plan details for the drugs that you take on a month-to-month basis. I'll also give you that estimated, oh, this is how much you'll pay each month for drugs. For each plan, it looks like that Kroger's gonna be $36 a month, while the Publix, it's gonna be $41. Give you the tier information, your drug list. Talks about Part B and Part B drugs. Since Medicare Advantage plans combined for A, B, and D, essentially, your Part B drugs will also be included here. And it looks like for chemotherapy drugs, you have a 20% in network co-insurance, as well as for other Part B drugs, which sometimes include transplant drugs. Goes into the star ratings for the plan and then the plan details.